Hello, my name is Jody Ann Brown, Jody for short, and I will be presenting on the maternal health and economic benefits of breastfeeding. Just a little introduction. I am a mom. This is a picture of me breastfeeding my son at 6 months old. He is now almost a year old. When given the opportunity to present on a topic, I knew I wanted to focus on breastfeeding and its benefits, but I was a little disappointed to find there was significantly less research on benefits for mom versus benefits for baby. So I really wanted to highlight the research available in hopes that there will be some attention given to the maternal benefits of breastfeeding. Here are my table of contents. I will review the current breastfeeding recommendations, breastfeeding statistics, maternal health benefits of breastfeeding, highlighting some health benefits, their statistics, and the studies to support, maternal economic benefits of breastfeeding, a summary, conclusion. I've included some breastfeeding support links and the references. So currently, the American Academy of Pediatrics, the World Health Organization, and the U.S. Department of Health and Human Services all have pretty similar recommendations, and that is to exclusively breastfeed for 6 months, then introduce complementary foods, and continue breastfeeding for up to 1 year. The Healthy 2030 breastfeeding objectives for infants includes both increasing the proportion of infants breastfed through age 6 months and through 1 year. So these are the current recommendations and the objectives from Healthy People 2030 for breastfeeding. Despite the recommendations I mentioned, only 58.3% of infants were breastfeeding at 6 months in the year 2017. 19.2% of infants were fed infant formula before 2 days of age. And I've included a link here for the breastfeeding rates by state in 2017. And I wanted to take a quick look here at this table, breastfeeding rates among infants born in 2017. They have a column here for ever breastfed, breastfeeding at 6 months, breastfeeding at 12 months, exclusive breastfeeding through 3 months, exclusive breastfeeding through 6 months, and breastfed infants receiving formula before 2 days of age. And I thought it really interesting just to look at the differences just by states. For example, here you have Alabama, forever having breastfed, it's 69%, while a state like Idaho, for example, 94.6%. When you look at the breastfeeding rates at 6 months versus 12 months, the rates are even lower in comparison. And then even lower when we look at exclusive breastfeeding through 3 months and through 6 months. So I thought this was just a great table to look at just to see the differences just by state of breastfeeding rates. So, cancer and heart disease are among the leading causes of death in women. And the literature I reviewed shows reduction of risk of certain cancers and reduction of risk of cardiovascular disease and hypertension just by breastfeeding. So, I really wanted to highlight certain cancers, cardiovascular disease, and hypertension risk reduction as a health benefit of breastfeeding. Breast cancer statistics. Breast cancer is the most commonly diagnosed cancer in women. In 2017 alone, there were over 250,000 new cases, And breastfeeding is now being considered as a modifiable risk factor, just like they would look at diet or smoking or exercise. The first study we will look at is from the collaborative group on hormonal factors in breastfeeding. They combined data from 47 epidemiology studies conducted in 30 countries and examined the relationship between breastfeeding and breast cancer. They analyzed over 50,000 women with invasive breast cancer and over 96,000 women in a control group without breast cancer. Results show there was a 4.3% reduction of breast cancer risk for each year a woman breastfed and an additional 7% reduction for each birth. It was concluded that the longer women breastfed, the more they were protected against breast cancer. Another study was a 2013 meta-analysis of 32 studies that sought to investigate the effects breastfeeding had on breast cancer risk. They found that the risk of breast cancer was 11% lower among women who breastfed compared to women who gave birth but did not breastfeed. They also concluded that breastfeeding for more than 12 months led to an increased protective effect of 28%. Though the mechanism by which breastfeeding has a protective effect on breast cancer is not clearly known or understood, trends in both these and other studies suggest breastfeeding may reduce breast cancer risk. Cancer of the endometrium is the most common cancer of the female reproductive system. Worldwide, it is the sixth most commonly occurring cancer in women and the 15th most commonly diagnosed cancer overall, with over 380,000 new cases alone in 2018. This first study is a meta-analysis with individual participant data from 17 independent studies from the epidemiology of endometrial cancer consortium. This study assessed the association between breastfeeding and endometrial cancer risk. They compared over 3,900 women with endometrial cancer and over 17,000 women in a control group, and was found that having ever breastfed was associated with an 11% risk reduction of endometrial cancer compared to women who had never breastfed. The association appeared stronger with increased duration of breastfeeding. Ovarian cancer causes more deaths than any other cancer of the female reproductive system. Second is the second most commonly diagnosed gynecological cancer in the US, and it is typically life-threatening and has a poor prognosis as it is typically diagnosed at an advanced stage. A meta-analysis of 32 studies investigated the effect of breastfeeding and giving birth on the risk of ovarian cancer. They found that the risk reduction of the first birth on ovarian cancer risk was 30%, while the combined effect of the first birth and breastfeeding was 40%. Breastfeeding therefore provided an additional 10% greater risk reduction than giving birth alone. The evidence linking breastfeeding to reduce risk of cancers warrant more research and more focus on promoting breastfeeding as a modifiable risk factor. Cardiovascular diseases and hypertension. Cardiovascular diseases are the leading cause of death globally, with more people dying from cardiovascular diseases than any other cause. Most cardiovascular diseases can be prevented by addressing behavioral risk factors such as smoking, unhealthy diet, obesity, and physical inactivity. Breastfeeding should also be considered as a modifiable behavior and incorporated in the development of potential strategies to prevent cardiovascular diseases in women. This first study is a cohort study conducted by the Danish National Birth Cohort with over 60,000 women with infants, and they examined how any full or partial breastfeeding durations were associated with maternal risk of hypertension. It was found that any breastfeeding for 4 months or more was associated with a 20 to 30% lower risk of hypertension and cardiovascular disease compared to fewer than 4 months. A longer duration of breastfeeding was associated with longer maternal risk of hypertension and cardiovascular diseases. The second study is a systematic review of over 3,000 non-smoking postmenopausal women in Korea, and they found that the risk of hypertension lowered 10% for every child breastfed, and that was increased by 4% for every 1 year increase in duration of breastfeeding. They concluded that the more children breastfed and the longer they were breastfed was associated with a significantly lower risk of hypertension. This third study is a large prospective cohort study among 300,000 women in China. This study found that women who had ever breastfed were at an almost 10% lower risk of cardiovascular disease. Each additional 6 months of breastfeeding was associated with a further 3 to 4% lower cardiovascular risk. More studies are needed to further explain the mechanism and association between breastfeeding and maternal cardiovascular health. Moving on to the maternal economic benefits, the US Senate Committee on Appropriations in 2018 directed the Economic Research Services to conduct a study on the economic benefits of breastfeeding, including the effects on WIC and Medicaid costs. They proposed that if 90% of WIC infants in 2016 were breastfed, that WIC participation would increase by 8% monthly, leading to a program cost increase of an estimated $252 million that year. However, the higher WIC costs would be partially offset by an estimated $111.6 million in savings on federal Medicaid costs, and $9 billion in savings would be accrued to WIC households and their non-Medicaid health insurance providers. Higher WIC breastfeeding rates would reduce current and future health-related costs for mothers and infants participating in WIC. This last study I will review is one in Spain that aimed to estimate the benefits that increasing exclusive breastfeeding rates both at hospital discharge and at 6 months postpartum would have on the economy. They looked at savings from 4 pathologies for which there is robust evidence of a lower incidence among breastfed infants. These 4 pathologies were otitis media, or an ear infection, gastroenteritis, respiratory infection, and necrotizing enterocolitis. It was found that a 1% increase in exclusive breastfeeding rates at 6 months of age would have reduced healthcare costs by 197 million euros per year as a result of a lower incidence of all the 4 pathologies listed. It was concluded that the Spanish national health system could benefit very substantial economic savings if exclusive breastfeeding rates were increased. In summary, the health and economic consequences of inadequate breastfeeding are substantial, not only for children and their families, but also for the economy. In addition to the improved well-being of mothers and their infants, breastfeeding can positively impact society as a whole and should therefore be better defined in public policy. In conclusion, studies suggest that breastfeeding for at least 6 months is associated with reduced risk of certain cancers, cardiovascular diseases, and hypertension. If breastfeeding rates were increased, not only would there be substantial health benefits for both mom and baby, but it could also lead to substantial savings worldwide. Future research is needed not only to understand the mechanism by which breastfeeding has a protective effect, but also to further investigate all the health benefits that breastfeeding may provide for mom. Here are some breastfeeding support links that I found very helpful when I was breastfeeding. This is for La Leche League, Kelly Mom, and for WIC. Here are the references. There are 21 in total. Thank you for listening.